what are the risks? I mean, there's been talk about it being, some people say, oh, they've never heard about it, so therefore it's very experimental, maybe it's not very safe, etc.
Yeah.
Is keyhole surgery experimental?
No,
in any way?
Keyhole surgery has been performed for last 30 odd years safely, and I personally have been doing it for last 15 years at least, and I've been teaching people how to do this technique throughout the country and throughout the Asian region, and I don't see it as experimental. Lots of people lots of countries, even Asia, are performing keyhole surgery very safely. It's just something that parents need to be aware of, to request for this to be done for their child. You don't want a big cut when you can get away a small cut. So,
right. And in Europe and in the States, it's often the go-to method.
That's right. Yeah. So
Right.
that's the basic technique that people go to, both for adult and for children. Children surgery has been sort of lagging behind adult surgery in the magnitude of about 20 years. So whatever's been developed for adult surgeons, 20 years later we are doing it for children. That's because the technique is more delicate for children, and it takes slightly longer to develop the techniques for children because they're much smaller. And also the equipment there's been a lag in the equipment manufacture for children specific instruments. But however, the equipment has been developed 30 years ago. So although the lag has happened many years ago, so in fact the adult keyhole surgery has been happening for the last 50 years.
Right.
And children's surgery 30 years. But that's all in the developed countries. In Malaysia, adult keyhole surgery has been performed over 30 years now, and there's no issues with that.
Right. And the fundamental techniques are the same.
Exactly. Well, the techniques are slightly similar,
Yeah.
using similar instruments, but in the miniaturized
Of course, yeah.
version. And also the surgeon needs to be slightly more delicate because the space that we work in for children is so much smaller. And of course, once you're trained enough to do these surgeries, there's no difference in the outcomes. Keyhole surgery versus open surgery.
Okay. Thank you, Doc.